My name is Dr. Asha Nuthi. I'm a medical retina specialist in Oceanside, and I want to talk to you about epiretinal membranes. Epiretinal membranes, or macular pucker, or cellophane maculopathy, or a wrinkle in the retina are all different names for a fine little film that can develop over the macula, which is the center part of the retina. This is usually seen in patients after the age of 50, but can be seen in patients even much younger who happen to be nearsighted, have had prior trauma. This film that builds up over the retina can cause patients to see wavy lines, blurred vision, for a color and contrast vision to be decreased, and some difficulty with reading or driving vision. So epiretinal membranes can be idiopathic, meaning we don't have any cause for developing them. They can develop after a posterior vitreous detachment, where the vitreous releases from the retina and can leave a little film, which is this macular pucker or epiretinal membrane. And also in some patients, epiretinal membrane can develop after a retinal tear or a hole. So epiretinal membranes can be followed for many years without treatment. Sometimes they can pull and cause fluid to build up underneath the retina or cause a macular hole. Most patients who have an epiretinal membrane don't require treatment or surgery. Only 1/3 of patients who have epiretinal membrane progress to the point of needing vitrectomy surgery and peeling of the epiretinal membrane. So epiretinal membranes again can cause wavy lines on an Amsler grid or difficulty with reading and driving vision. So it is very important, if you've been told that you have an epiretinal membrane, to at least have an annual dilated examination with the OCT image to ensure that the epiretinal membrane is not pulling and causing any fluid or a hole to develop in the macula.